Hi everyone, it's Dr. Roni MD here, and I just want to talk to you guys briefly about the COVID vaccine. Okay, so I had a few of my followers ask me some questions regarding the COVID vaccine, and I wanted to answer them um, as simply and um, completely as possible. Okay, I'm not going to get into the super sciencey about it, but I'm hoping that I can answer your questions. And if you have any more questions, feel free to send them to me at Dr. Roni MD on Facebook or Instagram. You can always email me at drronimd@gmail.com, or go on my YouTube and uh, leave a comment if you have, any questions or comments or concerns that you guys want to, uh, have discussed here on my videos. So, one of the first questions I had was, which of the two vaccines are better? So, in case you haven't already heard, which I'm pretty sure like everybody's heard, you've got the Moderna and you've got the Pfizer. For the most part, they're pretty similar as far as you know you guys getting the vaccine. There's a lot of underlying sciencey stuff that and how they're being refrigerated and stuff. I'm sure you guys have heard about that on TV too. But as far as what's most important to you, um, as the general public, getting the vaccine, here's what you need to know. So they are given in two doses, okay? Both Moderna and Pfizer are given in two doses, okay? Now, Moderna has to be taken 28 days apart. From the first vaccine to the second vaccine is 28 days apart. So think Moderna, 1 month, 28 days, roughly. Pfizer is 21 days apart, okay? So 1 week less. So only 3 weeks apart for Pfizer, 4 weeks apart for Moderna, all right? Now, with Moderna, the minimum age to receive the vaccine is 18 years old. Pfizer is only 16. At this point in time, it's not that big of a deal as far as the minimum age is concerned because we're starting at our older senior population and working the way down. So, it's unless you are an essential worker or your category has been, as far as the population has been called upon to receive the vaccine, you don't really have to worry much at this point in time as far as the minimum age requirement to receive the vaccine. Now, some stuff that they do have in common, they both contain eggs, some preservatives, and latex. Another question, do they contain mercury? I know, they do not. Neither of them contain mercury, okay? Um, Now, if you are concerned because maybe you've had some allergies to medications in the past, or you have some sensitivities, you may want to go online and look at the full ingredient list for both Moderna and Pfizer vaccines, if that is a concern for you. So if you've had any issues ever before. Now, with that being said, there are some people who should not at this time receive either Moderna or Pfizer vaccine, okay? But even with that, still consult your primary care physician regarding the issues as to why you shouldn't receive it at this time, okay? If you've ever had a severe allergic reaction, and when I say that, I mean anaphylaxis. I'm talking you need that EpiPen shot in your thigh and run you straight to the ER. You're looking like Will Smith did in the movie Hitch, okay? That's what I'm talking about. So if you've ever had an anaphylactic response, a severe allergic response, or an immediate allergic reaction to any ingredient in the mRNA COVID-19 vaccine, you should not get the vaccine at this time. If you've had a severe allergic reaction to the first dose, don't get the second dose. Okay? Not at this time. Don't get it. Okay? Now, what I mentioned before, the immediate allergic reaction, which basically means you had a reaction within the first 4 hours of getting the vaccine. So that includes the hives, swelling, or respiratory distress, wheezing, anything that causes you to have difficulty breathing. Which is why typically you'll be asked to stick around for a period of time after you receive the vaccine. They're not just going to give you the vaccine and send you on your merry way. You're going to hang around at the facility for a little bit so they can monitor you to make sure that you are okay? Or there will be some sort of medical professional around to make sure that you're okay, or that you'll be given some information to contact somebody if you aren't feeling quite right. All right. Now, also, if you have an allergy to polyethylene glycol or PEG or polysorbate, which is closely related to PEG, PEG is in the vaccine, then you are advised to not receive the vaccine at this time. Okay? Now, some people might be saying, oh, well, I heard about, this or that happening with the vaccine. I saw this on the news. They were talking about, someone dying or having such a horrible reaction. Now, yes, the reactions happen. I'm not going to sugarcoat it or lie or beat around the bush. The reactions happen, okay? But they are so few and far between compared to the most common side effects. And yes, there are side effects, okay? This is not a side effect free vaccine. This is that it doesn't exist, okay? There are always a chance for some sort of side effects, but the probability that you will have one of those super severe side effects is very, very, very slim. Okay? Not impossible, but slim. So, most common side effects. In your arm where you receive the vaccine, okay, you might have some pain, some swelling, and some redness. Okay, those are most common. Throughout the rest of your body, you might feel some chills, some tiredness, and you might get a headache. From talking to colleagues and hearing their experiences, typically these side effects last a day, max 2. So you should be okay after a day or 2, okay? Now the question that was posed to me, if I had COVID-19 and recovered, do I need to get the vaccine? Short answer, yes. Yes. Yes, okay? Reinfection is possible. There are people out here who have gotten COVID more than once, okay? Which means it's possible to get it again. When you get sick with the COVID or any sort of infection, you acquire a natural immunity. But we don't know how long this natural immunity is going to last at this point. We don't know. COVID is still, this strain of the coronavirus, this novel strain, as they call it, is still too new. We don't know everything about it, okay? So the fact that we do know that some people can get reinfected, it's advised to not just have your natural immunity, but to also have this vaccine-induced immunity, kind of have both, Now, if you have had COVID-19, it is advised to wait 90 days before getting the vaccine, okay? As always, consult with your PCP or your primary care provider before getting this if you have any questions in regards to the vaccine, if you have been infected with COVID-19, okay? And last question for today's video. Once I've been completely vaccinated, do I still have to wear a mask and socially distance? Yes, yes, and triple yes, okay? Just because you've been vaccinated doesn't mean you can turn around tomorrow and take your mask off, okay? We don't have enough information, and when I say we, I mean as in the CDC. We don't have enough information regarding when and if we can end the recommendations for wearing masks and socially distancing. So it is advised until we have what's called herd immunity, where a large, probably over 80% of the population has been immunized before consideration can come about to say when we can stop socially distancing and stop wearing our mask. But at this point, continue to do that and continue to wash your hands, okay? So I hope this information was helpful. If you have any other questions, again, feel free to post them, to send them to me, whether it's publicly or privately, however you want to do it. All this information I'm going to post at the end of this video so that you can see it typed out. And yes, I strongly advise everyone to go when the opportunity arises in your city, your region, your state to get vaccinated, especially my Black and brown folks, because we unfortunately were affected a lot harder than, you know, non-Black and brown folks, the non-Blacks and non-Latinos. And not so much that we, you know, we're more susceptible per se because anyone can get COVID-19, but because of how the country set up, because of how the healthcare system and our, you know, access to healthcare, and the fact that many of us are essential workers. We have to be out there on, whether it's the front lines or the grocery stores or whatever. We don't have the freedom and the liberty to work from home necessarily. So we are catching it more frequently than some of our white counterparts, and we are experiencing much more dire effects of the COVID-19. So I urge you all to get it when it becomes available to you. I understand that there's a lot of hesitation. There is. Not even gonna lie. I'm not gonna act like I don't know about it. I know about it. Okay? I feel you. And if you are hesitant about getting it, then please reach out to some trusted healthcare provider that you know, to talk to them and you know, ask your questions, have a conversation about it, because it's either, you know, do we get the vaccine and possibly experience maybe some of the super rare side effects that might be going on, or risk getting COVID-19 and most likely deal with the very, very severe, painful, very uncomfortable, and for some people, long-lasting side effects of experiencing and contracting COVID-19. You know, I care for you. I want you to be safe. My colleagues care for you. We all want you to be safe. Yeah, so again, if you have any questions, whether you post them to me or another trusted healthcare provider, please do so. We'll try to answer your questions to the best of our abilities. We don't know everything at this point, but what we do know, we'll definitely share with you. And yeah, so I really, really hope that some of this information you can take with you, pass it along. Again, if you have any more questions, definitely feel free to ask them. And yeah, I am looking forward to a healthier and brighter tomorrow, next month, next year, a COVID-free time, It's going to take a little while. Also, be realistic about that. It's going to take a little while for us to get there, but we're going to get there. So, this is Dr. Roni, and I'm being paged to take care of you.